Hey everyone, welcome back to the Neurologic Wellness podcast. Today, our guest is Andrea Jones. Thank you for joining us today.
Yeah, thank you so much for having me. I'm pleased to be here.
Yeah, and we're pleased to have you. And today, I understand we're going to be talking about a personal story of yours that you think would be great for our audience to hear. And I think based on what we talked about, it sounds like a lot of people are going to be able to identify with what you have to tell us today or what you have to talk about today. So before we get too deep into that, can you tell our audience a little bit about you and what you do?
Yeah, absolutely. So I am first and foremost a mom. I've got two young girls, 11 and 6 currently. My background actually, though, is in pediatric nursing. So I spent about 15 years working in acute care pediatrics, meaning we would float to, our regular med-surg floor, but we would also float to the pediatric ICU, NICU. So a lot of critical care experience within that before I went into teaching nursing students and then eventually stepped out of that kind of conventional model altogether and decided to go and practice with myself, I guess, for myself, to really help women balance their hormones and, work with families to address underlying health issues. So that's been in the last 3 or 4 years, and it's been amazing. I've loved every up and down second of it. So it's been fun.
Mhm. So you're a mom, you're in the healthcare sphere, and you have kind of a personal connection with your daughter and needing to kind of combine all of those things in order to help her, right?
Absolutely.
So tell us a little bit about that.
Yeah. So our journey with our daughter has been interesting. And I feel like I'm still kind of putting pieces together of her journey the farther we get from her initial diagnosis. But she was actually diagnosed with Pandas in 2018. So if you're not familiar with what Pandas is, it's pediatric autoimmune neuropsychiatric disorders associated with strep. So, or from acute strep. There's kind of two different ways that people use that acronym. Essentially, what that means is that she got a normal, like run of the mill strep infection that everybody typically gets. But for her body, it ended up creating an autoimmune trigger. Her body had an autoimmune response. And instead of attacking the strep bacteria, it began attacking the basal ganglia in her brain. And for kids, this can create a wide spectrum of behaviors. For her, it was rage and sensory meltdowns. Like within 3 days of the strep infection, she was a completely different child. And so, me with my medical background, I thought this cannot be happening. Like, I knew that that's what it was, but I couldn't accept that that's what it was because I'd really only ever seen one case of Pandas in my entire 15-year career of seeing, treating myself almost 2,000 patients. So that's to me, it was rare enough that I didn't think it was possible enough to hit me and my family. And so I'm second guessing myself, but I'm like, man, like she is this is like a night and day behavioral difference. Like, this is not your normal meltdown. This is not your normal tantrum. And so then, we're thrown from a pretty well family, like we take care of ourselves, I take care of my children, to really being thrown into the worst emotional fires you can think of. Like, just spending 5 or 6 hours a day dealing with meltdowns is exhausting for everybody. And then you're having to deal with finding a doctor who will listen to you, finding a doctor who will not just put a band-aid on the symptoms, but actually say, hey, we actually have to address, why is her body having an autoimmune response to something that's normal? Like we all should be able to, in some capacity, fight things that come at our body. And, our immune system is meant to do that. And so why is her body not doing that? Because if we can figure out what that is, then we can prevent long-term issues from this. So That's really, we were thrown in very quickly. It was not like there was a slow progression of behavioral symptoms.
Mhm.
And so I feel like I spent the first year of her diagnosis just trying to catch up to the insult from the injury. Does that make sense?
Mhm.
Yeah.
And how old was she again?
She was 7 at the time.
Okay.
Yeah.
And you said it was a pretty tough process just finding a doctor who would A, would listen, and then B,
Yeah.
someone who could kind of help her, right?
Yeah.
Uh, so I guess how many people did you actually go to, and when did you actually find some relief there?
Yeah. And so we ended up seeing 3 different providers. And at the time, which thankfully is less than the standard for a kiddo with pandas, typically it takes about 5 years for a kid to get diagnosed, which to me is horrible because I'm just thinking of how much inflammation and pain, and emotional pain that they're in just
Mhm.
from not getting help. And so I kind of had a list, of like, okay, if this doesn't happen, then I have to do this. And thankfully, my clinical background, I think, helped me to know what to do next if something didn't work. But we went first to our naturopath who she's amazing, super thorough, love her, but didn't really have any experience with pandas. And so she was very dismissive, not intentionally, I think, but just truly probably the same response I had, which was no, this can't be it. Like, well, there's just not enough, I haven't seen it enough for it to be a legitimate thing.
Mhm.
And so I kind of started to second guess myself after that appointment. Like maybe it's just behavioral, like, but this is really sudden. Like I just was kind of in disbelief about all of it. And um, started treating it with chiropractic and acupuncture and some other more holistic remedies, and really was not seeing barely marginal improvement, I would say. So then we went the route of a traditional pediatrician and got zero help there. They were like, no, Pandas is strictly OCD and she doesn't have OCD, so that can't be it. And and then we ended up finding a functional medicine pediatrician that did kind of did a mix of both conventional and holistic medicine. And he said, I'm going to run all the labs, but I can tell you by looking at her that she's having autoimmune encephalitis, basically. So he's like, yes, we're going to run all the labs, we're going to do all the things, but we should not delay in
Mhm.
treating. And so for us, that was about a 2-month process from beginning to actually finally getting a diagnosis. But even with that, it took us about a year to find a protocol that actually helped her. And we were trying different supplements and different medications, and do we need to go the route of working with a psychiatrist, all of those things, and really just trying to figure out what's the thing that's going to help my child get better. And for me, I think that was the hardest part emotionally as a mom. Clinically, I knew what to do, I knew how to navigate the medical world pretty well. But emotionally, as a mom, seeing that you're doing everything that you can to help your child thrive in their body, and being able to even just access her executive function skills, not being able to help her with that was the hardest part for me, emotionally. um, yeah, and feeling like you're doing everything you can, and it's not helping you get any further along in your process.
Right. And you had mentioned and just alluded to that you had such a well family,
Yeah.
right? Use that word.
Mhm.
And then for something so abrupt to kind of throw a wrench in that well-oiled machine, so to speak.
Mhm.
How did you and your family then cope with that? Because I think a lot of our patients and then family members of patients and listeners can probably really identify with that because a lot of the injuries and illnesses that we treat are pretty abrupt
Right.
and change lives pretty dramatically.
Right.
What was your experience like, and how did you manage that?
Yeah, that's a really good question. Honestly, I don't know that I managed it super well at the beginning because we were just, straight up survival mode. And at the same time, my husband was in school full time. So he's working full time and he's in school full time. And we have a 3-year-old who's neurotypical, and neurotypically a 3-year-old, which is a lot, and then a kid who's very, very sick. And so for us it was all hands on deck, meaning my husband and I pretty much teamed up and we're just like, when you come home, I'm taking the 3-year-old for a walk so that she can get a break. And we did the best that we could, but really there wasn't a lot of familial support. Occasionally the in-laws would step in, but there was a lot of just misunderstanding of what we were dealing with. And especially I think for that generation, it's very hard. I've observed, I should say, it seems to be very difficult to understand that something like a virus or an infection can affect behavior.
Mhm.
And so that was like a gap that we couldn't bridge. And so we just had to take whatever support we could get. And that didn't, unfortunately for us, end up being emotional support. It ended up being more, they would, come over and watch our youngest for us. It really wasn't until probably about 2 years into her journey that we started rallying everybody that we could. We finally just were like, you know what? This is do or die at this point. Like, we can't function in this kind of environment forever. And so I'm going to pull the closest people in that have been, in our life from the very beginning and just see how they can help us. And they were what became my SOS text like team. So we had a group chat set up, and they kind of forced me to do it, honestly, because I really didn't want to be in need of that. But they had a list. And so if I SOS texted them, they would divvy out that list amongst themselves of who's going to bring dinner, who's going to come do laundry, who's going to take my youngest to go have a play date. They were our survival team, and they are really what helped us to get through the hardest, probably 2 years after diagnosis, which was a lot of flares, a lot of, 2 steps forward, 1 step back.
Yeah. And you had mentioned, certain people find it really hard to, I guess, understand what's going on, especially
Yeah.
when it's virtually an invisible problem,
Right.
right?
Yeah.
It's not like she broke her leg and needed crutches. So it's like, okay, we
Right.
just need to help her with her crutches until her leg heals. This is
Right.
something happening inside her head that people cannot see. And I think a lot of people struggle with that, and
Absolutely.
especially with understanding. But I'm so glad that everybody was able to rally then behind her
Yes.
and kind of create this village mentality to help her out. That's fantastic.
Yeah, it was life, really life changing, and we're very thankful that those people are still a part of our journey, because we're not, she's not 100% healed yet. We are pretty close, like I would say probably 85% of the way there. I'm still waiting for the fever without neurological symptoms. That's like my big milestone with her.
Mhm.
But the fact is, she gets a cold now and she actually has physical symptoms of a cold instead of neurological symptoms. So to us, that's a huge win. But before we could even get that team of people in place, I started going back to therapy, just to help myself process the emotional impact of what we had been through. My husband eventually went back to therapy as well and did some marriage counseling in there, just so that we could stay a team, as
Mhm.
much as we were able to, and as much as we were dealing with this situation in very different ways. Like, his grief looked nothing like mine, and so learning how to have that healthy communication in there saved our marriage, because it is not an easy thing to walk through.
Yeah, absolutely. Communication is huge, and
Mhm.
I can only imagine how much stress this type of situation puts on, your marriage, your relationship with your family, extended family,
Right.
your other child. I'm sure,
Right.
had to make some sacrifices as well.
Absolutely. Yep.
Um, and the title of our episode is How to Take Your Worst Day and Turn It Into Your Best Life.
Yep.
So it sounds like you've really created a tight knit group around this,
Yep.
around your daughter, to be able to help her. I guess when you created that title, what what did you have in mind? Like how is this, or how have you created your best life from this terrible, terrible day?
Yeah, I think we are still making it, we're
Mhm.
still trying to make the best out of really horrible stuff that you have to walk through. And I think I just decided early on that how I looked at this was going to determine a whole lot of the outcome.
Mhm.
And how, if I looked at this as this is going to ruin our family, we're never going to recover from this, the trauma is too much, like, then I would just be in a constant state of overwhelm and fear and frustration and disappointment. And instead of like, okay, I have to look at this as like a treasure hunt. How am I going to find the gift in this circumstance? Which I know sounds really cliche. And I'm not
Mhm.
trying, like, I am not glamorizing the process because there have been plenty of really bad days. But training myself to look for the gift, which is, that my daughter trusts me and that we have a deeper relationship because of what we've walked through together. We have stronger communication because of what we've had to walk through together. My husband and I have stronger communication because we've had to. And those are things that money can't buy that, having a 6-figure earning job can't buy me that. That is really the ultimate, you know, the if the end goal for me is that at the end of this, we still have really healthy connections as a family, even if there's stuff to still work through, then I feel like I won. Does that
Mhm.
make sense? Like,
Yes.
we took that as best as we could and we said, I'm not going to be a victim to my
Mhm.
circumstances. And yes, that means doing the hard things. It means showing up at counseling. It means digging in when your own child triggers you because they've been screaming at you for 5 hours. It means digging into those places that are really, I would have probably never been able to, I would have never had a reason to go there and heal those issues, even in my own body that I
Mhm.
had been ignoring, had it not been for what helping her through her illness brought up in me. Does that make sense?
Right, it does.
Yeah.
Um, and how did you have to take special steps in preserving your own energy and your own health throughout this process?
Absolutely. Yes. And it honestly, it was not as much as I wish that I could have done. Meaning I wish that I had that hour of self-care every morning. I wish that I, had been able to go for a walk every day and go, get a pedicure every 3 weeks. Like, that would have been like the dream, right? But for
Mhm.
me, it all became about prioritizing something for myself every day, even if it's 3 minutes. And so that might look like, reading a book instead of scrolling Instagram at bedtime. Um, that might look like very intentionally reaching out to friends and just having a conversation that didn't involve what we were going through. It was just a kind of a surface level conversation. For me, that did look like prioritizing therapy, even when we didn't have the money for it. Because
Mhm.
honestly, when you're spending $1,000 a month on treatments to heal somebody's brain, you don't have extra. Like, we didn't have extra to be like, oh, yeah, we can totally throw $600 at therapy. But for me, it was a non negotiable. Like,
Mhm.
that is my self care, is to prioritize this thing, even though I'd much rather be doing something fun.
Sure.
Um, so, those for me, I had to make it very small, doable steps, making sure that I was eating clean food. And it didn't mean I ate perfectly, but it meant that I was, prioritizing the health of my body, because I knew that the stress would eventually take me out if I didn't. And so for me, being able to take even those little small steps, I do think preserved me until she was healed enough to where I could address more of what I needed and give myself more of what I had been lacking during that time.
Mhm. And I know hindsight being 2020, and sometimes this is easier said than done, but having gone through everything that you've gone through, what would you say to someone listening to this who may be just starting this journey, or maybe in the middle of it, where they're feeling frustrated, they're feeling hopeless? What would you do to encourage them along?
Yeah, I would say the biggest thing is not to second guess yourself. If you have that internal gut sense, whether you're a parent or for your own health, that something is off and you're being brushed off or just kind of overlooked, or hey, let's give this protocol another 2 months, and you're still just kind of stuck in the same place. My encouragement would be, to continue looking for the answers and don't ignore that internal sense that you have that something's not right. And I think especially as parents, when we're trusting somebody else to see what maybe we're not seeing, right? And so that's why we're bringing them to a specialist to see what maybe we can't see. And it's very hard when you're in that position, you have this just like nagging something is wrong, and you're being told everything's fine. Like, oh, it's just behavioral. Oh, she'll just get through it. And I'm like, no, her pupils have been dilated for 3 weeks. Like, this is not normal.
Mhm.
I'm not an expert in autoimmune encephalitis, but I know enough to know that that's not normal. And so I think we have to use that, if you want to call it intuition, use that intuition to fuel us to find better sources of healing. Because I just think, like, gosh, if I had waited like they told me to, it would have taken us probably another solid year to even get what we needed to. Does that make sense?
Mhm.
And that would be my encouragement. If you're a parent that is, working on healing your child, follow your gut, listen to that instinct. Don't just minimize or normalize behaviors that are not normal. Because as much as we're miserable trying to help them, they are 10 times more miserable being stuck in their body. And now my daughter can verbalize that. She can
Mhm.
say, it felt like I was watching myself do something that I couldn't stop.
Mhm.
And now she has, now she's walking through some grief over that, like what that felt like to her. And so we have to, I think, as parents, just not normalize the things that maybe we're being told to by, whether it's conventional medicine or media or the latest blog that you've read. I mean, there's so many different ways that we can just tune out our own senses, if that makes sense.
Mhm. It does. Um, how, if you're comfortable talking about this, how far does your daughter have to go, and what are some struggles that she's going to try to overcome moving forward now?
Yeah, absolutely. She is 11 now, so I always ask for her permission
Mhm.
before I share anything, publicly about her. And she's very much like, Mom, you can share as much as you want to. If it helps somebody else to get
Mhm.
better, I want them to know. Like, I want them to know, that this is possible for them. So she's very open about that. So I would say, for her, we actually ended up doing a neuropsych evaluation when she was probably at her sickest. So maybe like 11 months in, where we were still trying to find a protocol. She was really sick. I'm very thankful that we did. We happened to catch her right in the middle of a flare. So it would have been the worst cognitive function. And that's what we wanted to catch, was what is her brain capable of on her worst day, right? Um, so that actually gave us some really good insight into why she lost her her executive function. Like, she literally went from being able to unload the dishwasher by herself, being able to fold laundry, to not knowing where to put a spoon,
Mhm.
like within a week. And so she's regained almost all of her executive function, meaning, she knows how to take care of herself. She knows how to take a shower. Our current struggles right now are really, a little bit of the emotional regulation still comes up, where she will get dysregulated if she's exposed to anything that stimulates her immune system, whether it's a food she's allergic to, or um, allergies, seasonal allergies, or a virus or infection. So that's something that we see a little bit of an uptick in behavior with that we're still working through. And then the other kind of last remaining, what I would call, I guess, not really behavioral, but from a functional standpoint, is actually the ADHD component. So her ability to focus and have, attention to actually work through tasks is still kind of the big boulder that we're seeing slowly improve over time. But it's that really slow last symptom that we're just like, budge already.
Mhm.
But she's making it. So those are the kind of the two big things that we're still waiting to see like complete resolution on.
Yeah, well, she's definitely fortunate to have you as a mom to be there, supporting
Thank
her
you.
along the way, and she very, very fortunate in that regard.
Well, thank you.
And I really wish her well moving forward, and I'm sure all our listeners do too.
Thank you.
And if you had any, I guess, parting words of wisdom for our listeners surrounding this conversation we had today, what would that be?
Yeah, I think my cliche parting that sounds very cliche when you're in the middle of it, but just don't give up hope.
Mhm.
It's very easy when you're hitting brick walls and not getting the help that you need to feel hopeless or powerless. And I just want to release over you that you will find what you need. And there are doctors out there are physicians out there are practitioners out there that are actually invested in you or your child or your partner recovering. And so I would just say, hang on to that thread of hope. If it's the last thread that you have, and keep pushing forward, because there's a lot of really great resources out there. I mean, obviously, this podcast, your practice is a huge resource in that. And keep digging for answers.
Mhm. Absolutely. Thank you again for coming on today. And I think that parting word was perfect, even though it is kind of, you said, feels cliche to say, but sometimes that's just all someone needs to hear
Right.
when they're in kind of a darker moment. So thank you
Absolutely.
for providing your story and your daughter's story today, to help encourage others along the way. So you're definitely
Absolutely.
not alone in this. So
Thank you. Thank you for having me.
yeah, it was my pleasure to have you. So anytime, yeah, if you ever want to come on and talk again, happy to have you.
Awesome. Sounds good.
Awesome. Well, this has been your host from the Neuro Wellness Podcast. Be well.